Good morning. And I really want to thank all of our partners on this important. It's not an emergency announcement that we're doing today. Although our health care system locally and nationally is in an emergency state, our call today is not to add to that emergency by the overuse of emergency rooms, which is siphoning off much needed emergency care for countless number of people. And one thing about the Brooklyn Health Network throughout the entire borough, they get it. And when we sat down with our partners and told them about what we wanted to accomplish, without hesitation, across the entire borough, they said, Eric, sign us up, we're on board. We see what the overuse of emergency rooms are doing to our everyday use of our healthcare facilities. And so I want to thank all of our partners. The president of this hospital is not here because of a family emergency, but he has been a great partner. We were here a few years ago when this urgent care center opened, and we want to continue to thank him, and that's our Mark Tony, the CEO and president of Brookdale Hospital. We also have Marlene Ford, Regional Director of Community Healthcare Network, Doreen Russo, Pro Health, Urgent Care, Gwendolyn Lewis, Vice President of Interfaith Hospital, Dr. Christina Johns, PM Pediatrics, and countless number of other partners that we have to thank. I particularly want to thank Atalia Granshaw from my office, who's really the architect behind the video, the whole concept. After having her baby, she came back with this care of making sure that we continue to raise healthy children and families in Brooklyn. Thank you so much, Atalia. Black Noise Media, producer of PSA, Brookdale University Hospital Medical Center. Some of the locations that will be showing the video, because it's about meeting people where they are, and some of our partners will be showing the video. BAM, Barclay Center, BM Network, BRIC, Brooklyn Plaza Medical Center, Community Health Network, Interfaith Medical Center, Common Health, Kingsbrook Jewish Medical Center, MCU Park, New York Cosmos, New York Health and Hospital, Coney Island, Governor Kings County Woodhall, New York City Medical, New York City Lutheran, PM Pediatrics, Pro Health Care, and Radio 103.9. That is only some of the starting groups and organizations. Our goal is to have this video played inside the dollar vans that transport people to and from their place of employment, beauty salons, barbershops. The Department of Motor Vehicle has an excellent video usage there at the same time. So the goal is to send a strong message of how do we properly utilize the emergency rooms. No one sits down and explains to a patient, a child, a parent during non-emergency situations on how to properly utilize the emergency room. So by the time you go to access health care, no matter what it is, if it's a minor or major health care issue, the first thing you think of is to go to the emergency room. We want to stop that. When you do an analysis of what is taking place in the state of New York, a study in 2013 indicated that 17% of emergency room visits statewide results in inpatient admission. Here's the number that's frightening. 83% of visits were treat and release, meaning they could have found alternative non-emergency care and would have been in the hospital or in the urgent care center or other centers and locations and out without a problem. Instead, they had to spend countless numbers of hours dealing with the emergency room. Our healthcare system is on triage, and if we don't deal with the most urgent cares first, we're going to put the entire system in emergency state of disrepair, and that's what we don't want to happen. The numbers speaks for themselves. When you look at the dollar amount that is spent annually, the American Hospital Association and the Federation of American Hospitals estimates that the dollars amount goes into billions of dollars. And then when we look at what's happening in the federal level with the Congress just voting on the repeal of Obamacare, this is going to hit us in a very severe manner in cities such as New York and states such as New York. We believe that we may lose upward of over $166 billion in medical payments. 27% of Americans under 65 will be uninsurable because of pre-existing conditions. So nationally, emergency room overuses cost us approximately $38 billion a year. Think about that number, $38 billion a year for overuse of emergency rooms in the city. And no one knows it better than Brookdale, and this hospital deals with many emergency cases. Our country is great at addressing acute illnesses, but we must do a better job at dealing with wellness and dealing with preventive long-term diseases. And in order to do that, we must free up our emergency rooms. And so our comments today, if it's not an emergency, use the alternative facilities that are available to deal with those minor medical incidents. The emergency room cannot continue to be used as a primary care facility. It is for emergencies. And that's what our video that we're looking, the PSA we're doing, is attempting to use an entertaining way to show Brooklynites, our fellow New Yorkers, and the country that this is the starting process of utilizing technology, mass media, to educate people on the proper use of medical facilities, and particularly the emergency rooms. If it's not an emergencies, don't use the emergency room for that. And so I want to call up Kari Edwards, speaking on behalf of Mark Toney, the President and CEO. Followed by him will be Marlene Ford, the Regional Director, Community Healthcare Network, and Doreen Russo, Pro Health Urgent Care. Are you going to do the video now? Okay, we're going to do the video first. Hello, I am Brooklyn Borough President Eric Adams. Did you know that overuse of emergency rooms in the United States waste about $38 billion each year? If you have a minor issue, such as a cut or a cold, then visit a local urgent care facility, your primary care doctor, or a local health clinic. Leave the emergency room free to those who really need it. You'll be saving time and money in the process. Know the difference and avoid the wait. This is the modified version, the longer version. We have one of our Brooklyn stars, where is she? Who's playing in the video. The excerpt of the video is going to show a clock where you have two scenarios: a person who cuts his finger while cooking. He is going to show he and his partner go into the emergency room and go into an urgent care center, and it will show the different in time lapse of going into an urgent care center or going into an emergency room. And it shows the substantial difference. I don't know if any of you ever had to go to an emergency room and after camping out overnight, you realize how long it is to wait. When you utilize an urgent care center or one of our FQHCs to really be preventive care, it really takes away the time of not only clogging the system, but the overuse of the emergency room. And so that's what this is the short PSA that you just saw. The longer PSA is really going to be a act of showing the difference between using the two facilities. And so again, I want to call Mr. Kari Edwards, representing Mr. Mark Toney, President and CEO of Brookdale Hospital.
Thank you. Good morning, everyone. On behalf of Mark Toney, our CEO, Alex Roth, our chairman of our Board of Trustees, and the 3,900 employees, We're very grateful to have the Borough President choose us as the backdrop for this very innovative, forward-thinking process. Many of you who know the Borough President knows that he is the one person in Brooklyn who thinks ahead of the times. When it comes to our healthcare, is optimal for him and is most important. He was the leading legislator on having lactation rooms in government buildings. He's the forefront and spokesman on diabetes care. And now he's taking this initiative and talking about urgent versus emergent care health understandings. What's very important, we might have an emergency right now. 3 years ago, the Borough President came and opened up this urgent care center, and the hope at Brookdale Hospital was that we would reduce the fast track in our emergency room. We saw over 20,000 visits in the first 2 years, but we've never saw a reduction in our fast track in the emergency room. So we're hoping that this PSA and the education in our communities tend to get people to understand the difference between emergency versus urgency. So on behalf of Brookdale Hospital, Borough Presidents, we thank you as always.
Thank you, thank you. Well said. And before we bring up Marlene Ford, the Regional Director of Community Health Care, I think it was important what Kari Edwards stated. Throughout the city, we saw an increase of urgent care centers open, but there was never a match of that increase with a public education campaign to explain to people what are those centers. And that is part of the goal of really educating people to our FQHCs and our urgent care centers and alternative methods of utilizing medical facilities and how they should be properly used. Marlene Ford.
Oh, thank you.
Thank you.
Good morning, everyone. I want to thank the Borough President's Office for having us, Community Healthcare Network, and Brookdale Hospital on this lovely morning. So I'm here to talk about FQHCs and the services that we provide for residents. Community Healthcare Network has deep roots in the community. We have 13 sites throughout the boroughs. We have 3 sites located in Brooklyn. Currently, we're in the process of doubling one of those sites so that we're able to provide more services to our patients. We welcome all patients to Community Healthcare Network, whether you're insured or not, whether you're documented or undocumented. We really want to have you in our centers. We turn no one away. I just think that it's also important that people know that we offer preventative services and services for ongoing treatment if you do have hypertension or diabetes. We offer screening services. We have prenatal care. We have women's health care. We have dental health services. We have infectious disease, which we also treat HIV related illnesses. We have a robust behavioral health program. We have wellness programs for our patients. And I'm just going to see to make sure I'm not leaving anything out. Those are pretty much the gamut of services that we provide at Community Healthcare Network. We also have hours that are conducive for patients who are working. So we have a lot of our sites start at 8, and some of our sites go all the way till 8 o'clock in the evening. And we also have services available on the weekends. Thank you.
Thank you. Thank you very much. Point that was just raised by Ms. Ford. One of the #1 concerns in the city, particularly under this current administration, is immigrants, documents, and undocumented. When you go to your FQHCs, you're not being questioned of your document. There's not someone from ICE waiting to check your documents to see if you are a citizen or not. We don't want any undocumented person to believe the lack of access to quality health care based on their immigration status. And that is so important. I'm so glad that you raised that. Oftentimes, people who are not documented believe they have to go to the emergency room to receive their care. We will be reaching out to all of our partners around the immigration community to have them educate those undocumented residents to know that in no way, if you don't use an emergency room, would you be denied health care in this state. This is a sanctuary city, and state, and we want to make sure that everyone has access to health care. Next, we have from Pro Health Urgent Care, Ms. Doreen Russo. Okay. Next, we have Vice President of Interfaith Hospital, one of our partners, Gwendolyn Lewis.
Good morning. I bring you greetings from Interfaith Medical Center on behalf of the President and CEO, Ms. LaRae Brown, and the Board of Trustees and staff of Interfaith Medical Center. Like the FQHCs, Brookdale, Kingsbrook, and Interfaith offer a network of outpatient services so that we give patients the right care in the right place at the right time. We have at Interfaith a number of preventative health programs as well, so that your illnesses don't escalate to an emergency. We have a teen pregnancy prevention program in partnership with the Department of Health. We also offer a program in partnership with City Bike and the Department of Health, Prescribe a Bike, so that we can make sure that patients are moving and getting the exercise they need to help reduce the burden of illness that they might face. And those are especially with patients with chronic diseases. And we at Interfaith offer over 33 other specialty and primary care clinics. So if it's out there, it's in there at Interfaith. And so instead of the next time you become sick, you look at whether this is an emergency. Will it threaten my life? And if it doesn't, then maybe it's an urgent situation that can't wait till the primary care doctor's office opens the next day. And then if it's not that either, then please come to your primary care physician. And we urge the community that if you don't have a primary care physician, that you do find one and utilize that, because it's most important to have someone coordinating your care that knows exactly what's going on with you disease-wise. So the next time, I just encourage you to look at one of the ambulatory care programs if you should be in need of healthcare services. Thank you very much.
Thank you. Well said. Well said. And our final speaker before we open to questions is Dr. Johns, PM Pediatrics.
Thank you, and good morning, everybody. I love it when we end talking about our children, our future. For the health of all of our children, PM Pediatrics and I are proud to enthusiastically support Brooklyn Borough President Adams' initiative to spread the good word about appropriate use of acute care resources for all residents, both adults and children. Especially in the present climate, understanding where to go at the right time to get the right care at the right place, in the right setting, by the right person, for the right price is more crucial than ever. As a pediatric emergency physician who practiced for 15 years in an urban children's ED and trauma center, I've seen thousands of children who clearly did not need the services of an emergency department, yet waited for hours to be seen, drawing resources away from critical patients and adding significant cost to the healthcare system. Most of these patients can easily be seen at an urgent care, like PM Pediatrics, that specializes in high acuity pediatric patients. And yet, so many children continue to go to emergency departments. Why is this still happening? In my experience, it's because a single parent can't miss work to make an appointment during daytime hours out of fear of losing her job. It's because there's only one place to go that renders quality care for children after hours. It's because they couldn't get an urgent appointment anywhere else. And maybe it's due to lack of awareness, which is why Borough President Adams' initiative is so important. Specialized pediatric urgent care works. Last year at PM Pediatrics, we treated approximately 237,000 children in New York. Our top 10 diagnoses mirror those of the top 10 in children's emergency departments, including 22% trauma-related diagnoses. We see them faster, in a much less stressful and more pediatric-friendly environment, and at about 1/10 of the cost of an average emergency department visit, with almost every insurer covering these visits. We make it our business to know and stay connected with community pediatricians so that the continuum of high quality care for children is seamless. Sick and injured kids need to be seen somewhere, and if we on the urgent care side can prevent an expensive ED encounter, then we've improved healthcare in our nation for our children, even if just by a little. Thank you very much.
Thank you, thank you. Okay. Quick comment on Brownsville.
Hi, my name is Harvey Lawrence. I'm the president and CEO of BMS Family Health Center. We've been serving the community of Brownsville for about 40 years and also in East New York. We are an FQHC. We provide care in spite of one's ability to pay. We have extended hours from 8:30 in the morning until 8 p.m. in the evening, and we are also open on Sundays. Now, why do we have those hours? We have those hours because people do show up at the emergency room for things that can be treated in the primary care setting, and they do that because of the convenience of extended hours. They show up because they think at the emergency room that you're there 24 hours a day, but we're there at our health center until 8 p.m. in the evening, so that even if you get off from work, you can show up at our health center and we will take care of you. And we do all of the primary care that's necessary to keep you well. We believe in holistic medicine, total health, so that we practice preventive medicine. Keep you out of the emergency room and also to keep you out of the urgent care center. Thank you.
Thank you very much. I love those hours. So we're going to show the longer version. Why don't we open Q&A? Do Q&A, and this way, for those who want to see the longer version, they can watch the longer version. Okay, and we want to be very careful not to diagnose over the air. You know, if a person really believes they're feeling in a manner that they should be in an emergency room, we don't want to tell them not to. But if you have a cut finger, if your child falls and sprains his ankle, or damage his finger, or some type of injury, cut your hand with a knife, you should go to an urgent care center. If you're feeling an inner pain, you should go based on the severity of that pain. If you feel you should go to an emergency room, you should do so. It's important to use, as some of our FQHCs have stated, it's important by having preventive care. And when you're seeing your healthcare professional on a regular basis, that's just part of the conversation we want to push forward. You'll be able to properly know pre-existing illnesses and when you have a new sort of injury that you can go to an urgent care center. One of the other healthcare professionals, but as my staff is pointing out, historically, these non-emergency scenarios, people end up across the street sitting in the emergency room. And they get frustrated and angry when they see someone comes in with a heart attack that goes in before them, but in reality, that is what triage is about. Now, in an emergency room, if you have severe allergic reaction, abdominal pain, breathing problems, broken bones, burns, chest pains, cut with heavy bleeding, head injury, pregnancy complications, seizures, self-harm, or suicidal thoughts, strokes, these are serious issues that you should go to the emergency room. So this is just a rough list. Each case is a case by case, but it gives the everyday public just some basic knowledge of when they should go to an urgent care center or a FQHC and not sit in the emergency room. This is what we are going to hand out just to give people an overall understanding of what they should look for and just to give them an idea to change their mindset. Any other questions before we go to the long version? That, you know what, and I thank you for that. Some of the best things we've done at Borough Hall, from our lactation rooms, the others came from everyday people asking the right questions. And so we're going to look at and see how can we better improve accessibility to the urgent care centers, listing of the hours and whatever information. But we also are a strong believer in FQHCs. Those local facilities in your community, by identifying who is your primary care doctor and getting basic information of treating those pre-existing conditions is so important. Building out a health plan is crucial. As a person that has reversed his diabetes, I know how important it is to have a primary care doctor that can send you to the different specialties to come up with an overall health plan of how to ensure that you don't end up in the emergency room because you are doing the right preventive steps. As indicated, when a mother is pregnant, the prenatal care, what you should do while you're carrying your baby, what foods you should eat, what lifestyle you should have. There are things we can do to bring down the numbers of emergency care by having a good preventive, well thought out medical plan, which don't happen. I'm pretty sure many of the individuals who provide services to the inner cities realize that because we don't have a good preventive plan, we end up in emergency rooms far too often, and we want to stop that, and that is our goal. Yes. Mm-hmm.
Hi, so I'm Marlene Ford again from Community Healthcare Network. I just want to add something that's probably important for patients and residents to know. You don't need to be a registered patient to come into our center. We accept walk-ins, and we'll take care of registration and anything that needs to be done for patients to get seen at the time of the appointment. I just think that it's important for people to know that.
Excellent. Okay, we're going to show the long version for those who want to see it with our star. Hello, I am Brooklyn Borough President Eric Adams. Did you know that overuse of emergency rooms in the United States waste about $38 billion each year? Our goal is to help reduce these health care costs and, more importantly, make sure everyone gets quality medical care in a timely and efficient manner. Not all injuries or illnesses require a trip to the emergency room. Before you go, ask yourself, is it an emergency?
Hey babe, I'm gonna make a snack for us to take to the Brooklyn concert. Just some finger sandwiches. You want turkey?
Yes, please. And I'm gonna text Leslie and Edison to see where we'll meet them.
Okay.
What happened?
I cut myself. Hey, look at this.
It doesn't look that bad.
Is this an emergency? Urgent care centers primarily treat illnesses or injuries that require immediate care, but are not serious enough to require an ER visit.
Wait, this is an emergency, miss, come on.
Sir, please take a seat over there and someone will be with you soon. Mr. Roberts, right this way.
She saw how serious it was.
Well, look at this.
If you have a life-threatening condition, such as chest pain or trouble breathing, please call 911 or visit the emergency room. Urgent care, an alternative to ER, where you receive qualified medical attention by qualified medical professionals, and there is no appointment necessary.
Leave the emergency room free to those who really need it. You'll be saving time and money in the process. Know the difference and avoid the wait. Average time in emergency room, over 4.5 hours. Average time in an urgent care center, approximately 1 hour. That's a substantial difference in time, a substantial difference in resources, and a substantial difference in dollar amount. $30 billion is wasted on the overuse of emergency rooms, and we want to put a halt to that. If it's an emergency, emergency room. If it's not an emergency, use one of the qualified alternative methods of seeking medical care. Thank you very much. I'll give you the exact number. Nationally, $38 billion is wasted on emergency rooms, overuse of emergency rooms. And if we look nationally, New York City and New York State is one of the big cities in the country, so a substantial amount of that dollar amount impacts the city and state here. Thank you, all our partners, thank you very much.
Thank you for pulling me in there. I don't know what happened.
Eric, thank you.
Thank you.
I just wanted to let you know.
Oh, yes.
Yeah,
Look at that in.
Yes. So I'm telling you, hi from the family. Yes, thank you. Yes.